obviously most practices have reopened at this point, and they've got some processes in place, and they're using perhaps the ACERT guidance in addition to, guidance provided by their associations, local guidance, federal guidance, all of those things together. But what have we learned at this point since putting these recommendations into practice?
We have learned a lot since just following the COVID crisis. We've learned, for example, that surfaces are not as important as aerosol, that this is an aerosolized virus that can spread from super spreaders, but you never know who they are. And the Times just published a big paper on super spreaders. We don't know what they are. We just know they can give it to 20 people, while the other 9 in the room give the virus to nobody, but we don't know why. But there are these large boluses of virus which can be aerosolized. And so while surfaces might be important, small closed spaces for a prolonged period of time without masks is the worst. So you don't want to be with someone without a mask for prolonged periods of time when they're close to you. And it's probably 10 or 15 minutes if someone's positive, but you don't know they're positive till a week later. So I think what we do is have to assume everybody's positive, socially isolate. And I think by keeping these rooms clean, high circulation of air, wiping down surfaces, masks. So we wear N95s 12 hours of the day. Like the minute I arrive to the minute I leave, it doesn't come off except for lunch when I'm in a private room all by myself. Now I get hypoxic, and I'm hot and it's uncomfortable, but I'd rather be that than in the ICU. We've already had one of our head nurse's mother-in-law died of COVID. She's a registered nurse at one of the big hospitals in town, 62, perfectly healthy. I've had 10 colleagues' parents die of COVID in nursing homes in Canada, Britain, and in America. It's not to be taken lightly. It's a serious disease. It has lots of sequelae, and it's going to be around now. We've also learned for a couple of years at least. It's not going away this fall. It's not going away next winter. The vaccine will not be ready for prime time in December. And unfortunately, our leadership has been lacking tremendously on a governmental level. So we have to do it on a grassroots level locally and physician to physician, colleague to colleague, and set the standards, because we actually know public health. We know protect the cough, protect the spread, wear gloves, clean, and do all these things. And when you do that, it actually works. It's been shown.